Hi guys, welcome to my YouTube channel. I go by the name Dr. Achievement. In this video, I'll be talking about Temporal Mandibular Joint (TMJ). It's formed by the articulation of the mandible and the temporal bone of the cranium. It is located anteriorly to the tragus of the ear. On the lateral aspect of the face, in this article we shall look at the anatomy of temporal mandibular joints, its articulating surface, ligaments, and clinical correlations. You can appreciate this picture of temporal mandibular joints. We can appreciate the mandibular fossa, we can appreciate the articular tubercle, articular disc, and the mandibular head. Alright. So articulating surface, the temporal mandibular joint consists of articulating surface between three surfaces, the mandibular fossa and the articular tubercle, from the squamous part of the temporal bone and head of mandible. This joint has a unique mechanism. The articular surface of the bones never come into contact with each other. They are separated by an articular disc. The presence of such a disc splits the joint into two synovial joint cavity, each lined by a synovial membrane. The articular surface of the bones are covered by fibrocartilage. Ligaments. There are three extracapsular ligaments. They act to stabilize the temporal mandibular joint. We have the lateral ligament, runs from the beginning of the articular tubercle to prevent the mandibular neck. It is a thickening of the joint capsule and acts to prevent posterior dislocation of the joint. Sphenoid mandibular ligament originates from the sphenoid spine and attached to the mandible. Stylomandibular ligament, a thickening of the fascia of the parotid gland along with the facial muscles. It supports the weight of the jaw. You can appreciate here in the stenomandibular joint, you can appreciate the mandible. You can appreciate the joint capsule, and it is colored. It has a color. Joint lateral ligaments, sphenoid mandibular ligaments, stylomandibular ligaments. You can appreciate their color. All right. So this is the mouth cavity. This is the mandible bone, and you can see at this area, at this angle, we have the temporal mandibular joint. Here is a part of the eye socket, and this is the temporal bone, which is close to the eye socket, and this is the ear, the area of the ear. You can appreciate here. All right. So movements. What movements can temporal mandibular joints make? Movements at these joints are produced by the muscles of mastication and the hyoid muscles. The two divisions of the temporal mandibular joint have different functions: protrusions and retraction. The upper part of the joint allows protrusions and retraction of the mandible. The anterior and posterior movement of the jaw. The lateral pterygoid muscle is responsible for protrusion, assisted by the medial pterygoid, and posterior fibers of the temporalis perform retraction. A lateral movement for chewing and grinding is achieved by alternatively protruding and retracting the mandible on each side, elevation and depression. The lower part of joint permits elevation and depression of the mandible, opening and closing the mouth. So what is the nerve supply of temporal mandibular joint? The arterial supply to the temporal mandibular joint is provided by the branch of the external carotid, principally the superficial temporal branch. Other contributing branches include the deep auricular, ascending phalangeal and maxillary arteries. The TMJ is innervated by the auriculotemporal and mesenteric branch of mandibular nerve, CNV3. Alright guys, thank you for watching this video. It was just a short video explaining temporal mandibular joint, explaining the articular surface, explaining the movement it occurs, and the nerve supply. Alright, thank you and have a very nice day guys. Thank you.